Good evening and welcome to our parent as teachers virtual group this evening discussing from the Missouri Poison Center. My name is Julie Galadinsky and I'm welcoming you all tonight. The purpose of our job is to really help provide for families different resources that are in our community. And I wanted to share with you tonight a great resource that you can use with your family. Hope you don't have to use it, but just in case, we all have had those moments that you gave your kiddo the wrong medication, too much of one accidentally, they swallowed who knows what. They're a great resource for families. And I had attended this a training session with Amanda several months ago, and she has since then let us share her little presentation with you all. So I wanted to share the information with you all tonight. Please talk to your parent educator if you have any questions about the Missouri Poison Center. We have received got in the mail several great handouts for families kind of about the Missouri Poison Center as well. As some of y'all remember these good old Mr. Yuck stickers you can put on all of your chemicals and medications and keep them, of course, high, I hope. But we have these for all families if you're interested. Talk to your parent educator. And we also have this great magnet you can put in your refrigerator. It's a great little babysitting, tip. You have a little, book of information for your babysitters. Please feel free to have this number, put it on your phones. It's so important. I will remind families that this number is a nationwide program. So if you are traveling to Florida for a fun family vacation, maybe after COVID, you're welcome to call this number and someone will still answer the phone there to help you. This number is based out of here in St. Charles, as far as in our area in Missouri, down at the Cardinal Glennon Hospital where Amanda Ruback is there. And know that this Missouri Poison Center is staffed 24/7 by pharmacists as nurses in the area. So let's listen carefully to what Amanda has to say. All righty, let's listen up.
Hey everyone, my name's Amanda Ruback and I'm a nurse and the community outreach coordinator at the Missouri Poison Center. And so I'm here today to talk to you parents and caregivers about poison safety and how to keep yourself and your loved ones safe. So first off, I want to share with you a picture of the Poison Center team. And so here we are, we're all there smiling, happy faces, and we're nurses and pharmacists who will speak to you on the phone about a poison-related exposure or question. And so whenever you call the Poison Center, you will speak to one of us directly who is there to help you through the situation. And so no matter where you live, if you live in the eastern part of the state, western, and all sorts of different places in between, whether you're in the urban areas where we receive the most calls from, or the very rural areas of the state, you will get professional assistance 24 hours a day by calling the 1-800 number. It's on every slide, so I hope throughout this presentation you take a moment to take a look at the 1-800-222-1222 number and maybe even save it in your cell phone, which we'll talk about at the end. So here we are. As I mentioned, your phone call will come in. You'll speak to a nurse or pharmacist who is right there with you on the phone, looking through information, gathering information from you, such as what happened, how long ago it was, how much of the substance and what the substance was involved. And then we'll be better able to assist you with answering your questions, providing you treatment information and advice on what to do. And so if you're thinking, I can't believe that there's that many calls to the Poison Center, we really have a lot of calls that come in. And so we had almost 61,000 last year in 2019. And by far the most of our calls are what we call exposures, or things that actually happen to somebody. So a spray of a cleaner to the face, or a double dose of medicine, or a child getting into a chemical. But sometimes calls are for information calls, sort of like the questions you always wanted to know, but you didn't know who to call. Can I take medicine A with medicine B? Can I take this medicine while I'm breastfeeding or pregnant? What's the safe use of pesticides in my home around my kids or pets? And so those are calls you can call the Poison Center as well. And most of our calls on the right-hand part of the screen there, you'll see come from people just like you. moms and dads, caregivers, grandparents, and babysitters who call and ask questions. About 28% of our calls do come from healthcare professionals like nurses and doctors. So even the experts in the hospital do call for treatment advice if somebody is seen in the emergency room. And so most of our calls, as you can imagine, are for children under 5. So that 45% and that blue, light blue coloring is the majority of types of, or the age group where people need to call the Poison Center. Those are your kids getting into things, spraying things, eating things, finding things you didn't even know you had in your house. And those sorts of calls are by far our most common calls. We also get a lot of calls from adults. So medication calls, chemical calls, spider bites, plant exposures, all sorts of things. And so whether you're calling for yourself or your child, we can provide you information. And a lot of our calls are accidental or unintentional. And these types of calls are sort of the standard ones where it's, I ate this, I got this on my skin, my child got into such and such. But sometimes we do take calls for intentional or intentional exposures, such as misuse of medications or drugs or other substances. And so when you think about what types of things are poisons, I want you to look at this list here and see if anything surprises you. As you can imagine, lots of chemicals are on there. There are medications. There are things in our garages like gasoline. There is even some substances of abuse like methamphetamine and cocaine. There are everyday items like diaper cream, gummy vitamins, all sorts of different types of things that we get calls about. And in fact, a poison is anything that can harm you if it's used in the wrong way, in the wrong amount, or by the wrong person. So there are lots of different scenarios that could play into that. And so when we also talk about poisons, we know that poisons aren't just swallowed items. While by far that is the most common way a poison exposure happens, we receive calls about people getting things splashed in their eyes or on their skin. That especially happens to toddlers and young children as they dump things over their head or they spray from a spray cleaner bottle. And then we also take calls from inhaled products, gases in the air like carbon monoxide or chlorine gas or other types of things in the air or in the environment. And so you're probably wondering, why are kids most at risk? So why are my little ones the biggest reason why people need to call the Poison Center? And I know you know that kids put everything in their mouth, right? That hand goes to the mouth the minute they're able to find it. And those things always continue to go in their mouth. So we have to watch out for lots of things that could be in that area where they could access. And then always kids are curious. They're getting into purses and bags, they're getting into cabinets in the kitchen. They're really exploring and learning about their environment. And there are a lot of these products that are lookalikes. So something like a Pine Sol cleaner could look a lot like an apple juice bottle to a child who isn't able to read and use those other clues such as our sense of smell to lead us into the right decision. And then lastly, there is a lot of imitation. And so kids like to do what adults and older children do. You know, if you've ever cleaned the counter and then maybe you'll see the little one trying to mimic that behavior. And then sometimes that can lead into using something incorrectly or in the wrong manner. And so let's look at the 10 most common exposures for kids under 5. And we're gonna go from the back up. So first, our stomach medications. So our antacids, our antidiarrheal products, things like that. Next are pesticides. So these are things that we use in our home or for bug control or in our garden for weed control. Vitamins are the next most common. There are a lot of good tasting vitamins, gummy vitamins, chewable vitamins that kids do tend to get into. Topical medications, these are medications that go on the skin. So hydrocortisone cream, antibiotic ointment, other types of things often go on a toddler's toothbrush by mistake. Number 6 are our antihistamines, and that category is kind of our cold products, our Benadryl, and those sorts of things. Next, we have supplements and hormones. So that includes birth control and other hormonal supplements and other dietary over-the-counter products. Foreign bodies is a big catch-all for a lot of different things. That could be a Lego, a Barbie shoe, a little game piece to a game set, all sorts of things, mostly considered choking hazards. 3 are pain relievers. So we know that people keep Tylenol and ibuprofen and aspirin and things in our home, whether they're for children, the liquid or chewable, or they're for adults. These are high risk items as well as very commonly, common exposures for young children. Number 2 are our personal care products and cosmetics, our soaps and lotions and hair products and all sorts of things we keep in our bathroom cabinets. And by far the most common substance for children are cleaning products. And now, especially so with COVID, we want to make sure that we're keeping those safe and up high and out of reach. And so unfortunately, there are several things that are very high risk items. These are our deadliest exposure products. So these cause the most concern. And of course, I always mention there are 2 things on that list that are on both. So pain relievers and cleaning products being on the common and deadly list are a big concern because they are things that we see a lot of calls about, and then we also see a lot of harmful effects from. And I will mention, if you're not familiar with what hydrocarbons are, those are things that are flammable, typically oils, so like gasoline, lighter fluid, tiki torch fuel, very irritating to the stomach and lungs. And so here's some good examples at some of the Lookalike products. So as you can imagine, if you were a young toddler crawling around and you saw some of these red little circle candy type items laying out, you might consider them to be candy, as well as some of the tubes there that look alike, and other beverage bottles that look a lot like things that taste good, like our grape juice or apple juice, as I mentioned earlier. So we really need to be cautious and careful about what we have out in the eyes of children. But unfortunately, it's not just children who make mistakes. Adults can make mistakes as well. And so this was a daycare that mistakenly gave windshield washer fluid, the blue kind of jug of windshield washer fluid type liquid, to a bunch of children instead of Kool-Aid drink. Luckily, this ended well. There was nothing serious, but it was a very, very concerning mistake that an adult had happened to them. And so we really need to take the extra time, put our glasses on, read labels, take a moment, and really make sure we are at attention to doing what we need to at that time. And I know a lot of people really like to talk to us about things in nature, and we do get lots of calls about snakes and spiders and mushrooms and plant and bee stings and all sorts of nature type poisons or envenomations. And so these are all things that you could call the Poison Center and ask questions about as well. So moving kind of in a different subject, we're just going to briefly talk about why we're all at home and not able to be in person right now with COVID and poisonings. There really is a big increase in the number of poisonings that we're seeing because kids are home. We are home a lot more than we used to, and by far most poisonings occur in the home. Those products are out and ready for use. We're distracted, parents are stressed out, and we're also seeing lots of misinformation in the media or news about how to safely use products. And so when we look about things like cleaners and disinfectants, we really want to follow key safety instructions. So it's going to be really important to open those windows and wear gloves to make sure that those cleaning products are not used on food surfaces or body surfaces. They're not meant for that. We want to store all these chemicals up high and out of reach of children. One thing we see a lot is where chemicals are put into different containers. So maybe somebody puts a little bit of bleach or hydrogen peroxide in a cup, adds some water and tries to soak a dish or a piece of jewelry or something to clean. And then somebody else goes by after they've used it and does not realize it wasn't water. And so people drink it mistakenly. So you really need to keep those chemicals in marked label bottles up high and out of reach. And then not keeping things like pesticides and other chemical products near food items. So ideally, we don't have those in our kitchen, certainly not in the same cabinets as our other types of edible products. And when we think about hand sanitizer, there's so many different types now, and it is important to keep really good hand hygiene in the midst of COVID. We really want to encourage safe and supervised use. So all our kids know to use that hand sanitizer now. It really should be supervised for kids under 5 and only a dime size amount until it's rubbed in and dry. One thing about hand sanitizers that we are seeing an increases are eye exposure. So a lot of our newer products that came to market because of the lack of products, so people have been making hand sanitizer in different companies that traditionally don't, is that these products are a lot more liquid than gel. And so these thinner liquids spray or splash up into the eyes on mistake. And so that can be a concern. And then, you know, those little purse bottles and fun little things that we have our kids put on their backpack or in their room. For young children especially, I'm talking, you know, 5 to 7 and younger, young children, we really discourage use of that because it does attract them. So you can see cartoon characters. The one on the right there is the little pouch type hand sanitizer. It looks a whole lot like an applesauce or a baby food pouch and can be easily mistaken. So use them safely, teach your kids how to use them and keep them away when you're not using the hand sanitizer products. And then another quick word about medicine. We always want to make sure that medicine is kept in the original container if possible. Keep it again up high, out of reach, locked ideally. You'll see some locking little devices there that people can buy on Amazon or at your drugstore. And then if there are multiple family members on different medications, they need to be kept separately. So if 2 children are on a similar medication, both come in those prescription bottles, they should be in separate areas because we often find where they'll get mistaken and given to the wrong child. And then if you have any liquid medications or things that need to be stored in the fridge, it really should be stored in a separate fridge from food items because we have had some instances of children getting into liquid medicines that were really pretty serious, trying to get a drink out of the fridge by themselves. And so just a few more tips about medicine. We really don't consider any medication to be childproof. So even those hard to open bottles that are child resistant, many children as young as 2 can open those bottles. So they're just an extra layer of protection. They slow children down, but they often don't completely prevent children from getting into them. And because we talked about imitation before, we're taking medicine where kids can watch. So if you have young children and you're used to popping your vitamin or your pain reliever from that headache the kids are giving you, really take it where you're not being watched by your children, especially those little guys, because they're not fully able to understand that you're doing it in a safe way. But if they were to do it, it would be an unsafe way. And I know it can be really hard to give medicine to kids when they're sick or they don't like the flavor, but we really don't want parents or caregivers to call medicine candy. Medicine is medicine, candy is candy, and we really should draw the distinction between them. And it's also very important to use the cup or syringe that comes with the liquid medicine, or ask for one from your pharmacist rather than trying to use teaspoons or measuring devices from your kitchen because those are not very accurate for dosing. And of course, as we do with everything, we are constant teachers of our children. We want to make sure that we're teaching them to ask before touching or tasting anything that they find on their own. And so it's inevitable. Something may happen to you or your child. But here's some really basic first aid advice. Always, if it's a medical emergency where somebody's not breathing or has a seizure or is very drowsy, That's an emergency where you need to call 911. But let's say a child sprayed themselves with bleach and you were worried it got on their face or in their mouth. We want to make sure that we remove anything contaminated. We rinse the skin with lots of running water. And we encourage you to, of course, call the Poison Center so we can give you expert advice. Same thing with the eye, lots and lots of running water. I know rinsing a child's eye, a 2-year-old's eye, is not ideal, but we can give you tips and pointers on how to do that safely to hopefully avoid having to go to the emergency room. And then if somebody swallowed something, many people panic. Many people rush the child and go to the emergency room or call 911, where by far we can keep a lot of children at home with poisoning. Okay, so more than 70% of our calls to the Poison Center can stay at home. And so while it may be your first instinct to call and to be panicked, we want you just to take that extra time and call the Poison Center if it's not a true medical emergency. And then if somebody is in a home where there's something like a carbon monoxide alarm going off, or there's an inhalation or breathing in of something, we want to, of course, get them to fresh air and then always call for further advice. I want to show you parents just our website, and you can get to us on www.missouripoisoncenter.org. And so here's our homepage, and I just want to show you up at the top there, you'll see a little section that I circled called, "Is this a poison?" So if you find yourself wondering, I wonder about diaper cream or baby powder or whatever it is, you can look for an A to Z listing that'll give you some basic information. Now, we don't want you to use this as a substitute for calling the Poison Center, because we want you to call and feel comfortable to do that. But if you were just looking for some information, you can certainly go there. And if you certainly want more information, we always encourage you just to call. There's printable sheets where kids can color and do word searches. There's all sorts of activities. And so I encourage you to go to the Kids Zone to kind of make some learning fun for them. And so just to kind of wrap things up, I want to make sure that you know that you can call the Poison Center anytime. We're open 24 hours a day, 7 days a week. There's no judgment when you call the Poison Center. And I will definitely tell you that as a parent and as somebody who has worked on the telephone hotline, that we really encourage parents to call and not feel intimidated. We don't report, we don't call social services or DFS. We just want to give you medical advice and the best treatment information you can get. And then also, if you need assistance in a language other than English or have difficulty with language barriers, you can call and we can get a third-party translator or interpreter on the phone to help you 24 hours a day as well. So I want you now to do something with me, which is what I always do. I would like you to take out your cell phone right now and put the Poison Center number in your cell phone. You can put it as Poison Helpline or Missouri Poison Center, and then put in the number 1-800-222-1222. And so this is really important because, as I know, just from talking to lots of parents in my experience, that you remember the number right now, but when you need us maybe in a week, a year, or a month, or any time, you will have that cell phone number, that number saved into your cell phone that you can call us without having to look and search around. So thank you for your attention. I hope you guys enjoyed and learned something today. If you have other questions, don't hesitate to go to our website. And again, we appreciate you listening.
Thanks so much, Amanda, for sharing. Hope you all learned something maybe tonight and get it in your phone. Put it in there. Again, it's nationwide, so you can call from anywhere. Know that we all have had those moments. I'm glad she made a comment again. Don't feel guilty. We all make mistakes. Adults make mistakes for what we've taken as adults. It happens with kids. Kids swallow coins. They eat a mushroom outside on the grass. Oh my gosh, is it bad or not? Feel free to call I like how she shared the website is a really good, popular one. It's very, easy, friendly to look at. Again, MissouriPoisonCenter.org. So check it out if you need to. Hope you don't have to, but of course, if you need to, they're always there to help you out in any time of day, and any day of the week. So thanks so much for joining us tonight. I'm going to remind you all, if you are not in our program and be looking forward to some upcoming fun events, we have our egg hunt beginning April 1st. So stay tuned for more information about that in our next newsletter, as well as our discussion from pediatric anxiety discussion that'll be happening on April 15th. Thanks a lot. Take care, stay safe and healthy. Bye-bye.